Well, thank you for the invitation to join you. And today I would like to talk about the damaging health consequences of weight stigma, which not only reduce quality of life for people who have obesity, but which can also create barriers and obstacles in efforts to effectively prevent and treat obesity. So the primary message that I'd like to convey today is that weight stigma is not only a social injustice, but it's a public health issue. And weight stigma has damaging consequences for both psychological well-being and physical health. And it's both a consequence of having obesity and a contributor to obesity. We now see that weight stigma is present in many societies around the world, making this a global health challenge. And for researchers and clinicians in the obesity field, it's critically important to understand the ways in which weight stigma impact health, and we need to do a better job of addressing this issue in the medical community. So to begin, this slide shows the many ways in which weight stigma can negatively impact health. Weight stigma induces stress, maladaptive eating behaviors, lower physical activity, higher physiological reactivity, weight gain, psychological distress, and it can lead to lower quality of healthcare. And so this model helps to visualize the many different health consequences of stigma, which I'll provide some additional details about in the following slides. So first, there is substantial evidence that when people experience weight stigma, they have an increased risk for psychological distress. And that includes things like depression, anxiety, low self-esteem, poor body image, as well as substance use. And the emotional toll of weight stigma is considerable, especially when we consider that weight stigma can also come from close family members and friends. And so those close relationships are not necessarily available as social and emotional supports. And because we live in societies that do very little to challenge weight stigma, there really aren't clear ways for people to seek support if they have experienced stigma, and that can exacerbate their distress. So something I also want to note here is that a lot of the research in this area accounts for or controls for body mass index or body weight when looking at links between weight stigma and psychological well-being. And this is important because it tells us it's not just a person's body weight per se that is leading to these problems, but rather it's the experience of being stigmatized that is the direct link. And these findings have also been observed in both children and adults and in both community and treatment-seeking samples. So beyond emotional well-being, weight stigma also affects physical health. And a striking finding that has emerged in longitudinal studies is that experiencing weight stigma predicts weight gain and increased obesity over time. This has been demonstrated in population-based studies of adults in the US and in the UK, as well as in adolescent samples. And what the evidence shows us is that other forms of discrimination like race or gender-based discrimination don't have these same effects on weight gain. It seems to be unique to weight-based discrimination. So as an example of some of this work, we've done some longitudinal research with the Project EAT study cohort here in the US. And this has followed almost 2,000 adolescents for more than 15 years through their mid-30s. And specifically, we found that both girls and boys who were teased about their weight in adolescence were more than twice as likely to have obesity 15 years later once they were in their mid-30s compared to peers who weren't teased about their weight. And these analyses controlled for their baseline weight and sociodemographics. And so this tells us that weight stigma has implications for future weight gain in adulthood, even when these experiences happen early in adolescence. So an important question to examine here is, why are these associations occurring? Why is weight stigma increasing weight gain and obesity, and what are the mechanisms? So as we look at the links between weight stigma and weight-related lifestyle behaviors that could contribute to obesity, one of the health behaviors that is affected is physical activity. So in adults, experiencing weight stigma induces negative feelings about engaging in physical activity and lower intentions to do so, as well as avoidance of exercise. And in kids, we see the same pattern. We see very high percentages of youth report being teased about their weight during physical activities at school, which, not surprisingly, can lead kids to avoid physical activity classes or sports in order to escape that teasing. And it also reduces their engagement and enjoyment of physical activity. Substantially more research, though, has focused on links between weight stigma and eating behaviors. And a large literature shows that weight stigma is associated with maladaptive eating behaviors like binge eating. And we also see links with weight stigma and increased food consumption and unhealthy weight control and eating patterns. And so people who experience weight stigma have a higher prevalence and frequency of these unhealthy eating patterns. And these links are present in both adults and youth, in both community and clinical samples, and importantly, some of this research also controls for BMI. We also see these links between maladaptive eating and weight stigma persisting from adolescence to adulthood. So one of the reasons why these links with maladaptive eating may be present is that people may be coping with the emotional distress of weight stigma in ways that reinforce unhealthy eating behaviors. So as an example, about 15 years ago, we began to look at this, and we studied over 2,400 women in a self-help weight loss organization. And we asked them, how do they cope with weight stigma? And we found that almost 80% reported that they tend to turn to food as a temporary coping mechanism. And we know from a large literature base in psychology that stigma is a stressor and that eating is a common coping strategy to stress. And that certainly makes sense in the context of these findings. And as we've continued to see similar findings emerge time after time in our studies, I want to just highlight this slide, which is a more recent example of a national community sample of US adults. And we found that the more weight stigma that people report, the more they're likely to cope with stigma by engaging in disordered eating behaviors, increased eating, and avoiding physical activity. Now, unfortunately, these maladaptive eating coping responses begin quite early in youth and adolescence. So as an example here, we studied adolescents who had been teased or bullied about their weight in the past year, and we found that both boys and girls who reported emotional distress in response to being bullied about their weight were more likely to cope with those experiences by increasing their food consumption, binge eating, and avoiding physical activity. So these responses may really set the stage for patterns that become ingrained over time, which contribute to weight gain. Beyond eating and physical activity, weight stigma may also exert negative effects on physiological stress, and that also has implications for body weight. So evidence shows that people who experience weight stigma or discrimination have worse physiological responses like elevated levels of C-reactive protein, higher blood pressure, higher cortisol, and higher A1C levels. Now, importantly, these findings persist independent of BMI, and that again tells us that it's the experience of weight stigma, not body weight per se, that is increasing vulnerability to these physiological responses. So another aspect of weight stigma that's important to highlight in the context of health is something called internalized weight stigma. And that's the extent that people believe that negative weight stereotypes are applicable to themselves and in turn blame themselves for that stigma and for their body weight. And what we've learned in recent years is that this internalization and self-blame that people engage in may be particularly damaging for health. So when people internalize weight stigma, it can lead to the same health consequences that I've just discussed, and sometimes regardless of how much stigma they've actually experienced. So beyond a specific encounter of weight stigma, a person's internalization and self-blame may be detrimental. And we've seen in a number of our own studies that internalization has some concerning implications for weight management as well. And so I've highlighted an example here, which is a study that we conducted with adults who had lost at least 10% of their weight in the past year. Some of them maintained that weight loss while others regained. And we wanted to look to see what role stigma might play in these outcomes. And we found that while typical behaviors that are usually associated with sustained weight loss, like dietary monitoring and self-weighing, were not significant predictors for these groups, we did see unique predictive value of weight stigma, and specifically internalized stigma, when it came to who maintained versus regained their weight. And specifically, what we found is that for every 1 unit increase in internalized weight stigma, the odds of maintaining weight loss decreased by almost 30%. And this evidence suggests that the internalization and self-blame resulting from weight stigma may interfere with people's efforts to maintain weight loss, regardless of how much weight stigma they've experienced. Another recent example from our work is a large study that we did with adults engaged in weight management who are enrolled in WW, which was formerly Weight Watchers. And we found that internalized weight stigma, but not experienced stigma, was associated with lower odds of weight loss, higher odds of weight gain, and poorer weight management behaviors. And these findings persisted after we controlled for BMI and sociodemographic characteristics. So again, we see that internalized weight stigma is playing a role in potentially creating barriers. And now, in addition to these obstacles, internalized weight stigma may also increase cardiometabolic risk. And there's new evidence by Rebecca Puhl and her colleagues, and they've studied adults with obesity and found that the odds of meeting criteria for metabolic syndrome were much higher for people who had higher levels of internalized weight stigma. And this was controlling for BMI and depression and medication use and sociodemographics. So this is a new and intriguing area of research that does need more attention, but it certainly suggests some very concerning links between internalized stigma and cardiovascular health. And if we return again to how people cope with weight stigma, we're also starting to see evidence that internalized weight stigma aligns more with unhealthy coping strategies. So using that same WW sample that I mentioned on the previous slide, we found that people who internalize weight stigma use more maladaptive coping strategies in response to experiences of stigma, like disordered eating or avoiding exercise, and they use fewer adaptive strategies like seeking support. And I do want to just take a moment to mention that internalized weight stigma is not unique to adults. We see with youth and adolescent samples that they too internalize and blame themselves for weight stigma and bullying. And this internalization is similarly associated with negative health outcomes. So this is something that we have to be looking out for and addressing in children as well. Finally, as we think about health consequences of weight stigma, it's important to think about the ways in which weight stigma can actually negatively impact health care for people who have a higher body weight. And over the last 15 years or so, there have been a number of studies pointing to worse quality of care for patients who have higher body weight compared to lower body weight patients. On the healthcare provider side, evidence shows that providers tend to spend less time in medical appointments, they have less discussion and intervention, and less respect for patients with higher BMI compared to lower BMI. And on the patient side, those with higher BMI anticipate stigma from providers. They have lower trust in them. They're reluctant to discuss their weight and perceive a lack of empathy, believing that they won't be taken seriously. They're also more likely to switch doctors and avoid care. And so this work has led my team to specifically look at patient-provider communication about weight, examining how providers talk about weight with patients. And what we see is that when patients feel that a doctor has used stigmatizing language to refer to their weight, that this has negative implications, not only for their emotional responses, but for their own health behaviors. Because if this happens, they're more likely to switch doctors or avoid future medical appointments altogether. And collectively, this research tells us that we need to prioritize efforts to address weight stigma in healthcare and the medical setting. And this means that we have to engage both patients and providers on strategies to tackle this issue. So we've done some research in this area with adults who have obesity, where we ask them to rate the importance of different societal strategies to reduce weight stigma, some of which were relevant to healthcare. And as you can see here, almost the entire sample rated stigma reduction strategies in the medical setting as being highly important. Whether these strategies involve education on weight stigma and sensitivity training for healthcare providers, or requiring weight loss programs to include services that help people cope with weight stigma. And in separate research that I've highlighted below at the bottom here, we've done with healthcare professionals, and we see that they have agreement on this issue too, recognizing that healthcare providers should be receiving sensitivity training to prevent weight stigma in their clinical practice. So optimistically, we're seeing increased recognition by the medical community of the importance of addressing this problem. This past March in 2020, the journal Nature Medicine published an international pledge and consensus statement by the medical community to address weight stigma. And this involved a very comprehensive process with a panel of international experts who reviewed the evidence on the harms of weight stigma and developed consensus statements based on this evidence. And out of this came a pledge to end weight stigma, and the entire document was shared with medical and scientific organizations around the world. And at the time of publication in March, more than 100 medical and scientific organizations had committed to sign to the pledge. And so for the first time, we have a broad group of experts and scientific organizations that are really speaking with one voice to condemn weight stigma and pledge to help address this. And given the harms of weight stigma to health and the presence of weight stigma in healthcare, it really is critical that efforts to address this problem include both support and action from the medical community. So I see this as a positive step forward, and one that I hope will help improve the quality of care and quality of life for so many people who are harmed by weight stigma. So I'll end there, and I'd like to thank you very much for your time and attention.